Hello everyone, welcome to SONOGRIP. Today we will discuss about the most critical and life-saving scan, which is abdominal aortic aneurysm. A 66 years old male patient presents with a pulsatile mid-abdominal mass and progressive weakness of the lower limbs. So let's get started what we got. Abdominal aortic aneurysm is the dilatation of abdominal aorta where it reaches 3 cm or greater in diameter. As in this case, when we reach the infra-renal part of abdominal aorta, we see pulsatile cystic dilatation which appear fusiform in nature, and the lumen appears irregular due to the mural thrombi. This is actually a abdominal aortic aneurysm, and when we put the color doppler, we see the typical yin-yang pattern showing to and fro flow of the blood. And when we put the pulse wave doppler, we see not a normal aortic waveform, and it shows to and fro bidirectional flow pattern. We can also see that there is no para-aortic fat stranding and retroperitoneal hematoma or collection, which exclude the chances of rupture. The ultrasound won't give us the best abdominal aortic aneurysm measurement, so we should advise it further evaluation for CT angiogram to get the best measurement. Here is the measurement we took from the largest part, which is about 5.9 into 4.7 cm from outer to outer wall in transverse view. So let's summarize all the findings. There is a fusiform aneurysmal dilatation of abdominal aorta at infra-renal level, measuring about 5.9 into 4.7 cm from outer to outer wall with luminal irregular mural thrombi. There is no para-aortic fat stranding or retroperitoneal hematoma. Color Doppler shows yin-yang pattern, to and fro bidirectional flow seen on pulse wave Doppler. So that's all for today's case. Hope you liked the video. Please like and subscribe to SONOGRIP for more videos.